So we're wrapping up another great week. We're approaching the holiday weekend, a nice long 3-day weekend for most of us. And just thinking about the events of this week, and these are my thoughts of the week. So I had a patient today, had a long day today. It's pretty late into the night now. And I had a patient today who said, she was commending me on my office staff and how quickly they were able to get her in and how efficient the whole process was. And it really got me into thinking about how the art of medicine is kind of getting lost. I run a very small office. I have a handful of employees, and everyone is sort of abides by the core values of my practice: care and compassion, integrity, accountability, attention to detail. Those are my core values, and we really try to convey that in all of our patient interactions. And because I'm a solo practitioner, I have 2 offices, but I'm the one doctor that my patients see. It's very easy for me to coordinate the care for my patients. So for this particular patient's instance, she called the office, said her oncologist wanted her to have a biopsy of a particular lesion. And within a matter of days, we were able to get her into my office. And she was so appreciative of how efficient the operation was. And for me, that's just how I run my business. That's how we take care of our patients. But now that medicine is changing so much, and hospitals are buying practices and private equity groups are buying practices and really kind of, condensing the resources, it's very difficult for patients to get in touch with their doctors. And lots of times patients are lost in the shuffle. And it got me to think about why that is. And, really, for me, everything is about the golden rule. So when a private equity group or a hospital or a big corporation buys a small independent practice, the culture of the practice is lost, because the goal of a private equity group or for a hospital system is to maximize the financial efficiency of the office. So, a lot of times there are more PAs than doctors. It's really, the practices are kind of run like a mill to push as many patients through the practice as possible to generate as much revenue as possible. And patients become a commodity for practices like that. Patients become anonymous. I know most of my patients by name, even though I have probably 15,000 patients that I take care of. But I know my patient's story, I know my patient's name. These are relationships that I've developed over the last decade or so. And for me, I feel like the practice should be run in the exact opposite way. If you abide by the golden rule, you take care of your patients, you care about your patients, you do the right thing, you do the ethical thing, and you really go above and beyond for your patients, the money comes after that. That's the way it should be. It should be that you're providing an excellent service, and then of course you're rewarded for it. But a lot of what's happening in medicine now is just the reverse. You're maximizing the financial efficiency of the practice before really presenting a quality product for your patients. And the more that this is happening in medicine, and this is really happening across many, many fields. In dermatology, a lot of practices are getting bought up by private equity. Urology, a lot of practices are getting out by private equity. Orthopedic surgery, ophthalmology. This is just running rampant throughout the field of medicine. And I think the more that this happens, the more lacking our field is going to become, and the more our patients are going to suffer. So, I don't know what the solution is, but I do know that the corporatization of medicine, with health insurance companies kind of running the show, hospital systems running the show, it's really destroying the art of medicine. And again, I've said this before in my insurance posts, it's up to patients and their doctors to speak up, because ultimately it's the doctor-patient relationship that gets adversely affected when big companies kind of destroy the culture of medicine. So those are my thoughts of the week. Let's get it.